My name is Debbie. I'm currently a F3 doctor, so I'm locuming at the moment. I studied at Peninsula Medical School, and then I did my F1 and F2 at East Lancs, which is Royal Blackburn and Burnley General Hospital. I'm currently coming to the end of my F3 year and starting my F4 locum year as well. And I've got my colleague with me today, who is a friend from med school.
Hi, yeah, that's absolutely right. Devi and I met at medical school. I split my F1 and F2 into two different deaneries. So I did my F1 year in Plymouth at Derriford Hospital, and then moved to Oxford to try and get a bit more surgical experience. And then after that, I decided to take an F3. And just like Devi's doing, I'm also continuing to take another year out as a locum for various reasons that we'll delve into this talk. So yeah, that's a short introduction on what I've been doing.
So most of our talk is going to be about F3s and what you can do during this year and what opportunities are available to you. So there's currently about a quarter of doctors who feel very burnt out, especially after you do your F1, you do your F2, you're working very hard and you're very, very tired. So when it comes to the end of that period, you do feel exhausted. The classic thing that everyone thinks you should do is then go into training. There's a little bit of stigma on taking a year out, and people think that it may hold you back in some way. But actually, in 2019, 2/3 of people took a year out of training after F1 and F2. So it's informally called but it's just a year out. From F2 training has actually 11. There's very F3, yeah, if you do use it right, amazing experience. Develop much more than you can while you're in training. It's a valuable experience, valuable for personal development, increased flexibility as well. So you can take time off whenever you need to. You don't have to ask for leave. As I said before, you can develop your portfolio during this year as well and get a more diverse professional experience. It's also good if you don't know really what you want to do, which I don't know if Ali was in a similar position, but I definitely was, where I'm still not really sure what training I want to go into. If you may or may not know, it's now a little bit more difficult to go from one training into another. So if you want to go into IMT, then change into GP, usually do have to take a bit of a pay cut, which didn't used to be there before. So it can be a little bit more difficult to change training programs, which is why people take another year to make sure they really know what they want to do. There is a myth around F3s in terms of the fact that people think that if you take a year out, it will negatively impact your career. With the amount of people taking F3, I don't really think that's true, and you should take one. I would definitely recommend taking an F3 year. In terms of what you can do during this year, there are so many things. The first thing, obviously, that most people know is to locum. So locums are an integral part of the career workforce of the NHS. There's not enough doctors in the NHS, there's not enough doctors in the UK, so there's always gaps where they need doctors, and locums are essential for filling in those gaps. You can do agency work, or you can work through a bank. So if you've done your F1 and F2 and you've really enjoyed it, and I know a lot of people at East Lancs love their F1 and F2 and love the hospital, so they'll just continue locuming at the same hospital. You know exactly what you're doing, you know the system, you know all the specialties and where to work, and you can decide. The other thing you can do, which is another classic thing people do in their F3, is to travel. You don't get that much leave during an F1 and F2. You get about 9 days, obviously excluding weekends and days in lieu that you have. So it gives you a really good opportunity to travel, go on holiday, relax as well. You can also pick up a new hobby, something that you wanted to do. You'll try to do this in F1 and F, exhausting. It's really good for your own personal development. There's other interesting things abroad. You can go to New Zealand, you can go to Australia. Some of my friends have done anatomy demonstrator jobs. This is really good if you want to go into surgery, if you want to do radiology. You essentially work with a med school and you teach the medical students anatomy, so it's great for your portfolio as well. The other thing that you can do is if you want to do a specialty or try a specialty that you haven't got on your F1 and F2 track, you can then do a junior clinical fellow job in that job. So say, for example, you really want to think about doing oncology, but you haven't got oncology as a placement in your F1 and F2, you can then apply to be a JCF in oncology in a different hospital. This will then allow you to get more experience and then decide whether you want to do it or not. There's a lot of jobs that involve teaching fellows, which means that a percentage of your job will be to teach medical students or juniors. And a lot of these courses actually pay for you to do a PG cert, which also looks great. They also pay for medical education courses as well, or heavily subsidise it. You can volunteer as well, which is really good. And a lot of people I know have done expedition medicine courses. So there's courses where you can go to Chamonix and help and be a doctor while on skiing sessions and things. I know some of my friends have also done diving expeditions, so they've been a doctor during a diving expedition. The other thing you can do is just not work, because working is hard and you need time off, and it's important to give yourself that break to make sure you don't burn out just going into training. Some of the issues that can arise from doing an F3 year is if you are a locum, you don't necessarily get sick pay. During coronavirus, they were quite good. Some trusts did give sick pay to locums, but usually you don't get any sick pay. And the reason for that is that they do pay you a little bit more during locum per hour. So they say that covers for sick pay and annual leave, apparently. Job security is also another iffy thing. You will find work somewhere. It's just finding the work where you want to go. So you may have to move to a different trust, you may have to commute when you weren't doing it before. Alternatively, your commute could be shorter as well, but there will be jobs if you want them. They may just not be in exactly what you want to do. You still also need to get an appraisal. So although you don't have to worry about portfolios like you did in F1 and F2, you still have to get appraised every year to be able to get revalidated by the GMC 5 years later. I've actually made a website as well to help F3s get appraised. So it's just called www.guidetoff3.com. And you can go on that and it'll give you all the information. It's very easy. Appraisal is not as difficult as portfolio is. And interviews. So if you're going to actually apply the year after, you may have to come back from travels to do your interviews as well. Someone's just asked how long are the junior doctor fellowships. So actually some of them are a year. So I've got friends who've done this for a full year, they've done a fellowship for a year, but I know others who've only done it for 6 months. So I had a friend who just wanted to do ICU for 6 months, and she just did that through the bank. You don't get locum pay though for a lot of these fellowships, so bear that in mind. It will just be standard pay. But they do appraisal. That's the other thing. So you can get that sorted, and then maybe locum for the rest of the 6 months, or you could travel for the rest of the 6 months. Obviously, given Corona, might not be the best thing to do right now. But for future years, you could do that. So I've talked quite a lot. So Ali, I just wanted you to speak about like your experience as well as an F3, what you've done, and how you found it basically.
Yeah, I won't go through all the and because it sounds like Devi already has done that. And so I think I'll just talk to you about what I did as an F3 and my thought process regarding it, and bits and bobs that I feel I wish somebody would have told me about when I was starting out. So I think at the start, when you're sort of beginning to plan an F3, I wish I'd asked myself, what do I really want from this year? Because a lot of the time it's very easy to sort of take it as an alternative option. So, you're not going to go into training, but then you think, okay, well, I'll just take a year out and I'll figure that out later on. And I think it's sensible to try and ask yourself now whether you're looking to build up some sort of career expertise, or whether you're looking to sort of try and decide what you want to do in the future, or if you're just trying to save some money to buy a house, or you just want some time off from the busy schedules that you've been drawn into as an F2 and an F1. So those things I think I would ask yourselves when you're approaching this stage of making that decision. And then secondly, before you even start the F3, because if you've got a mindset that yes, I am due to go into training, I will go into training at some point, but just not this year, it might be worth considering doing a practice application. So for example, if you want to go into surgical specialties or medical specialties, as an F2, you're arguably in a far better position because your whole cohort is with you, and quite a large number of people in that cohort will be applying. So you can buddy up with people in that year and say, let's get our portfolios together, let's get all the points and all that tallied up, and you have it all ready